Feeling clumsy, stumble more, and steps seems wobbly, like they are drunk. This may look like a harmless old age thing, but to tell you the truth, it could be a sign of something more serious. So don't ignore it. Cervical spondylotic myelopathy is the most common cause of spinal cord compression in adults over 50. Wear and tear in the neck, disc degeneration, bone spur, thickened ligaments, presses on the spinal cord, and over time, this causes clumsiness in the hands, unsteady walking, and even bladder and bowel issues if left untreated. The spinal cord is the main communication highway between the brain and the rest of the body. It carries electrical signals for movement and sensation. Compression of the spinal cord disrupts these signals, causing delay. That's why hands get clumsy, legs wobbly, walking unsteady, and in severe cases, bladder and bowel problem and even paralysis. Unsteady gait in elderly sometimes is not just old age thing. It can be an early warning sign of cervical spondylotic myelopathy. If your parents is walking wobbly, don't ignore it. Timely diagnosis and treatment can prevent permanent disability. The following are 5 important questions about cervical spondylotic myelopathy, or in short, CSM. Question number 1. What is the signs of CSM? When the spinal cord is not working well, warning signs appear. Hands feel clumsy or weak. Simple tasks like buttoning the shirt and using chopstick writing get harder. Walking becomes wobbly. Legs feel uncoordinated, doesn't follow your command. Muscle weakness can come later. Grip is weak and you drop things. Lifting object is hard. Legs feel heavy. Walking and climbing stairs become difficult. These are the warning signs of CSM. Question 2. How is CSM diagnosed? Cervical spondylotic myelopathy is diagnosed through clinical evaluation and imaging. MRI scan can show the spinal cord, disc and joints, the level of compression, and if there is any damage in the cord itself. X-rays reveal bone spurs, alignment issues, and stability. CT scans can provide a detailed view about bones and calcified ligaments, which is especially useful before surgery. So you are suspecting cervical spondylotic myelopathy, you need to do all this. Question 3. Can CSM be treated without surgery? The short answer is no. Cervical spondylotic myelopathy needs surgery to free up the spinal cord. There is no treatment other than surgery that can free up the spinal cord. Sometimes there is compression of the spinal cord, but no symptoms at all. Walking is steady, hand function is fine, and in this case, just watch or monitor. But if the symptoms get worse, legs are weaker, hand clumsy, and walking unsteady, surgery is needed to prevent permanent damage in the spinal cord. So don't wait until the spinal cord is damaged, because surgery may not be able to fully reverse this damage. Question 4. What factors influence recovery after surgery for CSM? Recovery after surgery depends on several factors. How severe and how long has the symptoms been there? Mild or recent symptoms, recovery is usually faster. Age and overall health also matter. Younger, healthier people tend to do better, but CSM often occur in older people. The next one is the spinal cord compression or the damage. This also affects outcomes. Surgery done early and appropriate post-surgical rehab help regain strength, coordination, and mobility. Question 5. What happens if cervical spondylotic myelopathy is left untreated? If left untreated, it usually gets worse over time. Hands become clumsier, weaker, and more numb. Simple tasks like writing, buttoning get harder. The worst thing, a neck injury from a fall or a road traffic accident can even cause sudden paralysis. Over time, the spinal cord can become damaged, and the damage can become permanent. And recovery is much harder if there is permanent damage, even after surgery. Cervical spondylotic myelopathy is a serious condition, but treatable. Early recognition is key. Watch for hand clumsiness, weak grip, and unsteady gait. Do not wait until symptoms worsen. Delaying treatment can lead to permanent spinal cord damage, and timely surgery and proper care can protect function and improve the quality of life. If your hands feel clumsy and walking wobbly, you need to see your doctor. I believe this information is useful. Help me like, subscribe, and share. Thank you so much for watching, and see you again next time. Bye-bye.